I'd like to end with just each of you taking out your crystal balls and giving us your thoughts on, we look forward 10, 20 years into the future. From a broad perspective, what is our healthcare system going to look like? And why don't I start with Gary this time and work our way backwards?
Yeah, I think when we look back 10 years from now, again, I have a technology bent to healthcare, we'll be amazed at how little innovation took place in medical devices in particular. We're seeing a dramatic slowing of innovation and R&D around the device side, and some of it's driven by longer cycle times with the FDA, less innovation going on in the state. So we kind of see, for lack of a better term, kind of this black hole for a period of 5 to 10 years where there'll be very little innovation, and maybe something happens after that, but we're in a real hole right now.
I think it really depends upon who is, who's driving the agenda. If the transformation of this industry, 20% of the economy, what have you, continues to be driven by politicians and not by providers, I would suggest to you we are on a glide path toward a single payer. I mean, that's where it's going to go. The government already pays for and consumes most of the health care in this country. They're going to take more and more control over it because it is going to have those budgetary impacts that they can't stand. I think that would be a tragedy. I think that if the providers drive it, you're going to see something that is much more actively managed. Interest rates aren't going to get any lower. We don't go to the equity markets. We borrow in the tax-exempt domains. It's never going to be any cheaper. Where are we going to get our capital? If we're not more efficient with what we do, if we are not able to better manage the care that we provide, we're not going to be able to be to our communities what we have been in the past. And that, again, could change to having more of a government intervention, because this is, at the end of the day, an essential service, like the fire department, like the police, like anything else. If you don't have health care, you don't have any quality of life. So we have to step up. If we don't, I would say it's a pretty bleak outlook.
I think it's going to get really bad before it gets better. I think in the next 4 or 5 years, I think Marco Rubio predicted it well, which is what we're seeing. Young people are not signing up for exchanges. Healthy people are not signing up. And the problem is that these exchanges were bid out giving certain confidence intervals of comorbidities. So insurance companies in the exchanges priced at a certain price level based on what the government told them they could see. And you'd say, well, that's a problem for the insurance companies. Well, no, it's not, because little known part of the Affordable Care Act is that if they fall outside of those confidence intervals, the government's on the hook for the dollars. So that's going to immediately drive up the cost for the government beyond Medicare to fund these exchanges. And I don't think without Medicare reform and without reform of that payment methodology, the government can't keep up. Our tax rates are going to go up, and it's going to push us into a spin. I mean, that it's going to be like 2008 all over again, this time driven by healthcare. Maybe at that point we'll confront our demons. I do think that in the long run, in the 10, 12-year long run, because I think that happens in 4 or 5, we will get into, for lack of a better term, a two-tier system, one that's predominantly government